Hi, it's Dr. Jordan Tishler from inhaleMD. Today I've been asked to talk a little bit about cannabis and pregnancy. And this is a very significant issue. Certainly many patients are of childbearing years, and we really need to figure out what we can do about this. The problem is, quite frankly, that the literature is all over the map. There are bunches of studies that say this is the worst thing ever and you should never go near it if you're pregnant, and it will cause great harm to your baby. And then there's sort of an equal number of studies out there that say, you know what, it's probably not super great, but it's not really going to harm anybody, and so what? So the problem, of course, is that pregnancy is a time of high emotional importance, and God forbid, should anything go wrong in the pregnancy, the last thing we want is to be able to look back and feel guilty about something that you did or didn't do right. In this case, what I tend to recommend to all of my patients is that they avoid cannabis while they're pregnant. And what that means in practical terms is that if you're planning to get pregnant, you should stop your cannabis use about 3 months before you start trying to get pregnant. And you say, well, wait a minute, that's a long time. But the reality is if you're a medical patient and you've been using cannabis regularly, that this sort of lore out there that it will disappear from your system in 30 days is really an underestimate. And I've certainly seen cases where people remain positive out to about 90 days. So that's where that 3-month idea comes from. And should you find yourself unexpectedly pregnant, then of course I recommend that you stop using cannabis immediately. And everything I've just said also counts for breastfeeding, because we do know that cannabinoids are expressed in breast milk. So that's the basic approach at this point in time to pregnancy and cannabis use. This is Dr. Jordan Tishler from inhaleMD.